Hey everyone, I'm Drex, and this is the 2 Minute Drill where I cover 3 hot security stories twice a week, all part of the 229 Project Cyber and Risk community here at This Week Health. You can join our community. I'll keep you posted on all the latest webinars and podcasts and all the other sort of inside info. Plus, I'll let you know where we'll be as Sarah and Bill and I barnstorm the country as part of our 229 project, city tour dinners, and summits. It's easy to stay in the know. Go to thisweekhealth.com, click on the Join the Community button, and you'll be signed up. Today's 2 Minute Drill is brought to you by Google. Healthcare systems are lowering cost and boosting endpoint security with Chrome OS devices paired with Chrome Enterprise, a secure browser that's trusted by billions of users. So now there's a better way for healthcare teams to work safely on the web. Learn more or schedule some time with the Google Healthcare team at thisweekhealth.com/Chrome OS. Great to see everyone here today. Here's some stuff you might want to know about. A week into dealing with their cyber attack, Ohio's Kettering Health says radiation oncology is back online. It looks like some components of the call center are back up and running too. That's all good. They say emergency rooms and clinics are operational, and other healthcare organizations in the greater Dayton and northern Cincinnati area have really pitched in to help. I love that. It's another one of those things to kind of think about, I think, as we talk about cyber attacks or really kind of system-wide outages of any kind. If those outages last for an extended period of time, all the healthcare organizations in the region are affected. Patients who would normally go to the hospital that's closed because of a cyber attack, those patients are now diverted to other community facilities, and those facilities may or may not have the physical or staff capability, other resources to handle the new unanticipated patient workload. And that means patients and families are at risk. So as you do your tabletop exercises and other exercises, it's a great opportunity to put everyone in the room from across the region to talk through the options for patients and staff and ambulances and communications, all of it. A cyber challenge like this at a single facility can obviously create a cascading event into all the other region's facilities. So be prepared. When I was at the 229 Project CISA Summit in Boston a few weeks ago, we were actually talking about cyber exercises and who should be invited to be a part of those exercises. And one of the participants mentioned the Cybersecurity Infrastructure and Security Agency, or CISA. Totally agree. All of the participants agreed, but then everyone also voiced concerns about the cuts that have happened at CISA. Well, it's being reported this week that most of the leaders of CISA's operating divisions have left or will leave by the end of this month, all part of the federal government's downsizing efforts. And sure, it feels like this is exactly the wrong time for this to happen, given, you know, a record number of healthcare cyber breaches and China's typhoon attacks on US telecom. And I don't know, do I really need to make a list? We talk about this every week, and I think about it every day, just like you. And frankly, like many of you, I'm kind of pissed. I'm pissed at the bad guys who threaten our patients' and families' safety. And I'm pissed at the inability of the administration to lay out some kind of comprehensive, coherent cyber strategy for America. I just don't think you're on your own is a very good strategy. And it feels a lot like that right now. You've been fighting this war for years now. Your hospital versus nation states, your hospital versus non-nation state ransomware syndicates who are only in it for the money. And right when it looked like maybe the federal government might be developing a plan to help healthcare better secure itself, the plan disappeared. Now, we're all being patient. And I'm being a realist, though, when I think, I say, I don't think the federal government's coming to help, not anytime soon. So you need to find folks you can lean on and learn from. We can get through this, but I think only if we work together. And I'm here to help with that. Seriously, that's what I do. Drop me a note and I'll tell you more. You can stay up to date on all the latest healthcare innovation, tech, and security news at our news site, thisweekhealth.com/news. Today's 2 Minute Drill was brought to you by Google. You can keep patient data safe and reduce the burden for IT operations staff and create a better clinician experience, all with one platform. Google Chrome OS with Chrome Enterprise. Find out how by scheduling a chat today. Go to thisweekhealth.com/Chrome OS. That's it for today's 2-minute drill. Thanks for being here. Stay a little paranoid, and I'll see you around campus.